How to change an autism diaper properly. Changing an autism diaper is a routine task for caregivers of individuals on the autism spectrum. Proper diaper changing not only ensures hygiene but also helps maintain the comfort and dignity of the person with autism. In this guide, we will walk you through the essential steps to change an autism diaper properly. Gather your supplies. Before you begin, make sure you have all the necessary supplies within arm's reach. This includes clean diapers, wipes, a waterproof changing mat, a plastic bag for disposal, and any creams or ointments you might need. Choose the right location. Select a quiet, comfortable, and safe area for the diaper change. This could be a changing table, a soft carpet, or a bed. Ensure there are minimal distractions and that the person with autism feels secure in the chosen space. Wash your hands. Before handling any supplies or the individual, it's crucial to wash your hands thoroughly with soap and water. This reduces the risk of spreading germs and infections. Communicate and prepare. If the person with autism can communicate, inform them that it's time for a diaper change. Use clear, simple language and visual cues if needed. Prepare them by explaining the process in a calming and reassuring tone. Gently position the individual. Help the person lie down on their back, and if they have difficulty staying still, you may need an assistant to hold their legs or distract them with a preferred item or toy. Remove the soiled diaper. Carefully open the diaper, taking care not to rush or make sudden movements. If there is fecal matter, use the front of the diaper to wipe away as much as possible. Fold the diaper inward to contain the mess. Clean thoroughly. Use disposable wipes or a damp cloth to clean the individual's genital area gently. Be thorough but gentle, as some individuals with autism may have sensory sensitivities. Apply diaper cream, if needed. If the individual is prone to diaper rash, apply a recommended diaper cream sparingly. Ensure the cream is suitable for their skin type and consult with a healthcare professional if you have concerns. Lift and secure. Lift the individual's legs gently, making sure to support their ankles. Slide the clean diaper underneath them, making sure it's centered. For boys, point their penis downwards to avoid leaks. Fasten the diaper securely. Carefully bring the front of the diaper up and fasten it snugly but not too tight. Make sure it's symmetrical on both sides to prevent leaks. Double-check that there are no wrinkles or folds that could cause discomfort. Dispose of the soiled diaper properly. Place the soiled diaper in a plastic bag and seal it tightly to contain odors and prevent contamination. Dispose of it in a designated diaper disposal bin. Wash hands again. After the diaper change is complete, wash your hands thoroughly once more to maintain hygiene. Offer comfort and positive reinforcement. After the diaper change, offer words of encouragement and positive reinforcement. You can use this time to engage in a calming activity or provide a small reward to create a positive association with the process. Changing an autism diaper properly requires patience, understanding, and a supportive environment. By following these steps and adapting them to the individual's needs and preferences, you can ensure a comfortable and respectful diaper changing experience for both the caregiver and the person with autism.